morning, everyone. Welcome. It's a cold morning here today. It's this Friday. We get some snow, getting some flooding here. So anyway, so I just wanted to get this chapter started, this lecture started. So what we're talking about here, chapter 20, dealing with the heart. We're gonna always kind of get things started with a quote, and a good head and a good heart are always a formidable combination. So some good words from Nelson Mandela. So as we go to look, again, remind yourself that all these objectives, these are not my personal objectives. These are the ones from the college. It says this is what I should be testing on. This is what I should be teaching. So that's what I'm going to teach and test on. I always add a few things. So what we're going to do is as well is just kind of get started with the heart. We mentioned in lab that the heart is this hollow muscular pump that pumps blood through miles of vessel. So it goes through the blood, all the blood through the body. It's about the size of a clenched fist and weighs somewhere between 306 and 388 grams. Now, I could tell you that those kinds of things I'm not going to ask you about. The blood beats somewhere about 100,000 times per day. Now, these three terms here definitely are something you're going to have to know. And that's the pulmonary, systemic, and coronary circuits or circulations that blood passes through. The first one's pulmonary circuit. Now, with pulmonary circuit, systemic circuit, I'm going to kind of talk about it. And if we imagine here that we had a heart, and we're just going to use this as our basic heart here. We are going to have with our heart, and we are going to have things like a body, so our body here, and things like our lungs, okay? And with these two particular different sections that we've got to get blood to, remember we have a circuit called the systemic circuit, and we have a circuit called pulmonary circuit, and these two deliver blood differently or deal with blood differently. We know that this body systemic circuit is going to take, by the way, real quick before I actually get started, let me divide this up into 4 chambers. There we go. And if I take deoxygenated blood from the body and return it to the right atrium here, right atrium, and then I take this blood here and I send it to the lungs, and then lungs oxygenate the blood and send it to the left atrium. By the way, this would have been right ventricle. And the left ventricle sends that blood back to the body. So what you have is an entire circuit, including the right atrium and left ventricle, that deal with blood coming from the body and blood going to the body. And that's your systemic circulation. The pulmonary circulation here is dealing with blood going from the right ventricle to the lungs, and from the lungs back to the left atrium. So you will see that each half of the heart includes one half of these circuits. The systemic circuit includes the right atrium and left ventricle, where the pulmonary circuit includes the right ventricle and the left atrium. So those two major circulations that we have there, that's dealing with the blood coming to and from. Now, the other thing that we want to mention is there is like a subdivision of the systemic circulation. It is like a sub part of it. As the heart itself is part of the cardiovascular system, and the cardiac muscle cells and other cells of the heart, tissues of the heart, need blood. So to get blood to and from the heart, you need the coronary circuit. And that is like a sub-circuit systemic. So remember, pulmonary circuit blood that comes from the right ventricle of the heart to the lungs, back to the left atrium, or systemic circuit blood from the left ventricle to the body systems and back to the right atrium. So as we drew here, okay, as we drew just a little earlier. Okay. Now, in lab, we also discussed the position of the heart. We said this muscular pump pumps blood through miles of blood vessels. We said it was located in the mediastinum. 2/3 of the heart's mass is to the left of midline. The apex, the pointed end, projects inferiorly to the left of the body. This would be the left of the body here. And the base, the broad end, projects superior and a little more to the right. We saw that in lab. Also, what we saw in lab, and I'm going to come back and draw it again, though, just because I always like to, and try to make sure that we reiterate these things and really help it stick into your mind, is if I were to take my, again, very anatomically accurate heart here, that's the joke, right? And then I were to draw the body wall around it as a circle, then what we're dealing with here, we have body, wall, and we have the heart, and these two organs here, or this organ here and these two parts, they're going to have certain things surrounding them. They're going to have a double-lined sealed membrane. Now remember that one of these layers of a serous membrane are always fused and on the surface of the organ. So we want to get that on there as much as possible, as close as possible. And I'm drawing it in purple, but it is a double-lined sealed membrane. So the other layer that folds over it and is on the outside of it, and there's always these two distinctive layers. So there is always going to be the innermost layer, the one I drew in purple, is called the visceral layer. Visceral meaning organ, associated with the organ, so it's on the heart. So this is visceral pericardium, visceral pericardium. And the one on the outside closest to the body wall is parietal, pericardium. Parietal pericardium. And these two layers, now there is a pericardial cavity, as well, that's found between the two. Okay, now, what we want to discuss with this is that as we discuss the pericardial cavity and things like that, remember the pericardium is a double-lined sealed membrane called a serous membrane called the pericardium. And the pericardium has the outer layer and the inner layer. Outer layer lining the outside of the pericardial sac, producing a pericardial sac, the outer covering of pericardium. That is what we are referring to as the parietal pericardium. It lines and covers the outside of the pericardial sac. Now, since it has three layers, it is very tough. There is a fibrous connective tissue layer. There's the mesothelium and areolar. Remember, the fibrous tissue, connective tissue layer has the dense, irregular connective tissues. The mesothelium is the inner lining. Now, mesothelium is the simple squamous found on serous membranes because it's going to be found lining the surface facing outwards and found lining the surface facing inwards. So you have it on both sides in the middle. And then there is there's the areolar connective tissues, the loose connective tissue layer of that. Now, because of these three layers, it is more dense, more durable, more tough, harder to stretch. And this is why we get things like congestive heart failure pushes the inward pressure, is when you try to push against this outer three layers, it doesn't want to give that much and the forces are pushed inwards. And then there's a visceral pericardium called epicardium. Another name for it is epicardium, on the heart muscle itself, where you have your mesothelium, remember, facing out like this, and then the other one here, so you have your mesothelium. And the areolar connective tissues line the inside there towards your muscle tissues. And then there's the pericardial cavity, and there is pericardial fluid in there. Between the visceral and parietal pericardium, you have a cavity there. Now, there should always be a certain amount of fluid in that, and that's when we get conditions like cardiac tamponade, for example. in cardiac tamponade, when this fills up with too much fluid, the forces of that are pushing inwards on the heart and squeezing it, causing a type of congestive heart failure, and the heart is squeezed on and can't beat. So you're going to get this cardiac tamponade. Now you don't have to know cardiac tamponade. I just talk about it. You will see this in patho. So there's a reason why you learn those things. Okay, so now as we turn our attention from that, what we're going to look at is the wall of the heart. So we know that the epicardium, or the visceral pericardium, is fused to the heart muscle. So it's going to be on top, on the covering up your myocardium. So it's on the myocardium. And that myocardium is the cardiac muscle tissue. That's what makes the heart beat. And then on the inside of that is going to be the endocardium. Endocardium is going to be the lining of the inside of the heart. It's actually going to be covering the wall of the heart inside. It lines the myocardium inside. It covers your heart valves. It covers all the chordae tendineae on the heart valves, the tendons attached to the valves. And it's simple squamous called endothelium lining the inside of an organ, like a blood vessel. You would have endothelium. And all that good stuff. And then there's the areolar tissues associated to that. So the endocardium has got areolar and endothelium. All right. So you could get a condition here called endocarditis, where you would have an infection of that, and that kills people. Now, this is added to my notes. You will not see this to the notes that you currently have. I added it after I saw some changes to the slides. These are in there somewhere else. And I just want to add to the point that the base is the top where your great vessels are, the inferior parts, the apex, and the coronary sulcus is where the atria and ventricles, they form a groove called a sulcus. Okay. Now the cardiac muscles, something we want to talk about them very quickly, is that they have a structure in them called intercalated discs. And the intercalated discs allow the different heart muscle cells to be attached to each other, and allows them physical attachment using things like desmosomes, who will hold them in. So they are physically connected. So they are connected, but they also maintain a chemical and electrical connection using the gap junctions. Okay. Now, the cardiac muscle cells, remember, they have a branch structure. You can see that on the diagram. They have branches. They have single nuclei, and they are striated. Remember, this is an involuntary striated tissue. Okay. Now, also what we want to do is come back and draw our box heart together. And I'm not going to go through everything on there the same, but as slow. But we want to draw our little box heart together. This is going to help us to understand the flow of blood through the body and how that works, because if you can understand that, you will see this on entrance exams. That is a very big part, usually something they like to ask questions about. So we're going to draw the 4 chambers of the heart, 2 smaller ones and 2 bigger ones. We're going to draw a box here representing the body systems. So that's every body system in the body. And then over here we're going to draw a box, and we're going to label that lungs. Now, the position they're on, the side they're on, isn't going to matter so much here. Now, what we want to do is, real quick, is label left atrium. Or is this left? No, sorry. Right atrium. Left atrium. Right ventricle. Left ventricle. You can see what happens when you start at 7 something in the morning trying to record. Your brain isn't fully functioning. All right. So we have those. So what we want to do is also, as we do this, I want you guys to go in, and we're going to draw some extra thick wall here, okay? And the reason we're doing that is, remember, the left ventricle is thicker and stronger, more powerful, because it has to pump through miles of blood vessels. Okay, miles and miles of blood vessels. It's got to go to all the body systems. That is why it's so much thicker and more powerful. So it's going to have a thicker wall to it. Usually it's about 0.22 centimeters thick. Just to let you know the real thickness of a usual left ventricle. So the left ventricle wall is thicker. Now, what we also want to start with is, remember, the body systems are going to be giving that deoxygenated blood. So up here, I'm going to draw my box here, just referencing that blue equals deoxygenated blood. That blood is low O2, high CO2 blood. And that blood we're going to see is going to pass into the right ventricle. The right ventricle, when it contracts, sends that blood to the lungs, as we saw. Now, what happens at the lungs, we're going to see, is the lungs picks up oxygen, and it's going to send out oxygenated blood. And I'm going to use red to show oxygenated blood. Oxygenated blood. And the oxygenated blood here arrives to that left atrium we saw, passes through the valve that we're going to see in just a moment, and then it passes through and up to the body systems. Okay? Now, as this happens, we have a few things that we're going to add to this. Now, what I want to add is some valves and then all the blood vessel names. Okay? Let's use green, and we're going to put a valve here and a valve here. These valves are atrioventricular valves. Now, this one here has two names. The left atrioventricular valve, left AV, I'm going to abbreviate because I can't get the whole thing in there. And this one here, also called the tricuspid. Tricuspid. Remember, the valve with three cusps has two names. The valve with three cusps, tricuspid, has two names. This one here has two cusps. It has three names. The valve with two cusps has three names. And the first one is the, why do I keep doing that? I don't know why. Right AV valve. I'm so sorry for writing left. That's my fault. It's what I get for trying to start this really early in the morning with only one cup of coffee in me. Anyway, I just want to make sure I didn't get behind, because if we had, because the snow we're having right now, I just kind of came on in to get that started early. So I do apologize. I'm just not awake as much as I usually would be. And I think you could tell that. So the first one here, guys, is the left AV valve, also called the bicuspid, because the valve with two cusps has three names, and we also call it the mitral valve. If you've ever heard of mitral valve prolapse, that is involving this valve here. Now, then next we want to go in and add our other valves. I'm going to draw the lines this direction. It doesn't really matter. There's just a reason I'm doing it in opposite directions, just to keep it a little easier to tell the difference. This one here is called the pulmonary semilunar, and this one here is called the aortic semilunar valve. Okay. Now, so as you can tell, the aortic semilunar valve takes blood to the aorta, where the pulmonary semilunar valve takes blood to the pulmonary arteries. I was going to say A period for that. Here, coming to the heart, is a vein carrying oxygen-rich blood, is pulmonary veins. V period for vein. So that is your, this is your pulmonary circuit. And then here we have our superior vena cava and inferior vena cava. And I'm abbreviating it now because of it's just easier and simpler to do it that way. And I learned a trick. I learned that there's a button right here that says autofocus lock. So I actually autofocused it and locked it, so now that it doesn't try to focus when I put my hand in front of it. So, all right. So we have all that. So now, just to help you a little bit more, what I wanted to do was to help you memorize these valves a little bit easier in their sequence. So if we started at body systems and went through blood flow through the heart as it normally does, you would see the blood passes through the valves in a particular order. And to remember this, if let's say on the exam night, Mr. Lefford is having a heart attack, when you meet Ian, I'm having a heart attack, and you're trying to save my life, you might want to try pulling my aorta. That might save my life. Try pulling my aorta. So try tricuspid valve, pulling pulmonary semilunar, my mitral valve, aorta, aortic semilunar. Try pulling my aorta. And that is the order of sequence, 1, 2, 3, 4, that blood passes through. If we come from the body systems and we enter blood from superior and inferior vena cava, that deoxygenated blood arrives to the right atrium. When that blood arrives there, it passes through the right atrioventricular valve into right ventricle. Right ventricle, it leaves out the pulmonary semilunar valve through pulmonary arteries to lungs. At the lungs, it picks up oxygen, pulmonary veins, takes us into the left atrium, and the left atrium, this oxygenated blood, left atrium through the left atrioventricular valve. Now in the left ventricle, out the left ventricle through the aortic semilunar valve to aorta to the body systems. You will need to know that sequence of blood flow, where it goes. I'm going to ask you questions on this exam with like questions not only where does it go next or where did it come from, things like that. I could ask you which of these have oxygenated blood or deoxygenated blood in it, things like that, okay? So this is imperative to understand for a variety of cardiovascular issues. So like I said, if you haven't done it, I go ahead and just either take a picture, but if you aren't drawing these with me, you're really missing out, okay? There's a reason I put a lot of effort in trying to make sure that I can do these drawings with you. All right, so let's take a look at that. So as we saw, our right atrium received deoxygenated blood from superior and inferior vena cava, but also the foramen coronary sinus. I didn't draw it on the thing this time. I was being a little bit more, it's easy sometimes when you're flying off the cuff to always miss something that you might want to draw. The interatrial septum separates the two atria, and during fetal development, there's an opening in that septum called the foramen valley. After we're born, after birth, about 6 months or so, that starts to close up. Closure of the foramen valley creates a small depression in the septum called fossa ovalis. Now that can open up. Now the pectinate muscles are in the front wall of the atria, and that's what squeezes it. The auricles are what allows the atria to expand to gain more blood. Left atrium receives oxygenated blood from your left and right pulmonary veins. There are 2 left pulmonary veins and 2 right pulmonary veins. The right ventricle, remember, takes deoxygenated blood to the lungs. There's an interventricular septum separating 2 ventricles. The trabeculae carnes, the ridged internal surfaces of both ventricles covered in endocardium. The chordae tendineae. Now, the way I think about chordae tendineae is like this, and I want to explain it a little bit better, spend a little bit more time with that, and help you guys understand it. But let's say that here you are, and you are skydiving. Now, if at first you don't succeed, skydiving may not be for you. So what's going to happen is if you're falling from an airplane, you will die. Now, what do you need to make sure that doesn't happen? Well, you need a parachute. So if I had a parachute here, and my parachute that I had, if I was wearing a parachute when I jumped out, well, if the parachute isn't attached to me, it doesn't do any good that I actually have one. So if I attach myself to my parachute and jump, the parachute is going to slow me down. Now, think of you are like the papillary muscle. Okay? You're like papillary muscle. The cords of the chute are the chordae tendineae. And the parachute is the AV valve. Okay? So the AV valve, so while you here are attached to this, the chute can't fly up and away without you. So when the heart contracts, the person here would move up because the ventricle wall would contract, but as that happens, the person comes down and tightens up. Okay? So as he crouches down, he keeps these cords tight so the valve doesn't fly away. Because what would happen without these is these valves, if you have these chordae tendineae on the valves like this, and they are attached to pectinate muscle, when the heart contracts and moves upwards towards the valve, what would happen is this valve would be able to open up and back up in, and blood would go back into the atria. Blood would be able to sneak back into the atria. But if this pulls to tighten it and keeps these taut, the valve stays shut so they don't open. And I hope that makes sense is what they really do. So if you have them too long or something like that, you can end up with prolapse valves, valves where blood backflows goes, we call it a regurg, blood goes the wrong way. Okay. So I hope you guys found those helpful. Now remember the valves, you have your right AV valve, try to be right. Try to be right. The right AV valve is the tricuspid valve. It's between the right atria and ventricle. The left AV valve, left atrioventricular valve, the bicuspid or mitral valve. I always say try before you buy. That's between left atrium and left ventricle. Pulmonary semilunar valve is guarding your pulmonary trunk to the pulmonary arteries. So this means it's found between the right ventricle and the pulmonary trunk. And the aortic semilunar valve, they are between the left ventricle and the aorta, so that's going to be guarding the entrance to the aorta, preventing blood from the aorta, hopefully, from going back in. Now, that's going to be important for us to understand something in the second lecture that gets pretty difficult. Now, what is also important to understand about this is that when blood flows, as it flows, it tends to flow. Give me 1 second. Sorry, I had to move that. I had to go check my phone real quick. I thought I heard it vibrating. So, okay. So the right atrioventricular valve, you're going to see blood. It's getting into the right atrium, and to go from the right atrium to the right ventricle, it has to go through the right atrioventricular valve. Now, that right AV valve closes after blood fills the ventricle, and the right ventricle contracts, and blood gets ejected out of the right ventricle through pulmonary semilunar. Now, the thing is, if you didn't prevent the valves from going back, blood would back up into the atria, and we wouldn't want that. So when the blood enters pulmonary trunk, it goes pulmonary arteries to lungs. And it gets in the lungs capillaries, and it oxygenates that blood. Then, so what we see is the right AV valve is preventing that blood flow, backflow. It prevents what we call a backflow, a regurg, or a prolapse valve, where blood backflows can backflow through a prolapse valve. The valve prolapses, it goes up into the other side. Now, in the left AV valve, blood always flows from the left atrium and left ventricle through the left AV valve. So what we're going to see is when your left AV valve opens, blood can actually go into from the left atrium to left ventricle, and as that happens, your left ventricle contracts, and your valve should stay closed so blood goes out the semilunar valve to your aorta. And this prevents that backflow again. The left AV valve prevents backflow into the left atria. Okay? I got to click on that screen. Okay, so we've already seen this in lab, so let's talk about this a little bit. Remember, your superior and inferior vena cava, they bring deoxygenated blood from your systemic circulation to the right atrium. Your coronary sinus is part of the coronary circuit. It's in the coronary sulcus between the two ventricles. It carries deoxygenated blood from the coronary circulation to the right atrium, so it gets blood from the heart muscle tissues. Pulmonary trunk is like a tree and branches to give rise to the two branch called the right-left pulmonary arteries. They take deoxygenated blood from the right ventricle to lungs, pulmonary vein to per lung. They carry oxygenated blood to the left atrium from both sides. And aorta takes that oxygenated blood away from the heart to systemic circulation, because remember, arteries always away from the heart. And remember, there's an ascending aorta, an aortic arch, and a descending aorta. You'll see that in lab when we do the arteries. Okay? So, now the aorta. A few things we're going to see the aorta. Now, we'll talk more about this in lab, and I think it'll be a little bit make more sense because you'll be able to see it better. Is the aorta has two major sections. Now, there is an ascending aorta, and coming off that, there's an arch and a descending aorta. The two major divisions is ascending, which gives rise to the arch, and then descending after the arch. So before the arch is ascending, after the arch is descending, arch is between. The arch gives rise to three major blood vessels normally. And it's kind of bugging me that I forgot to do that, but I'm going to go ahead and do that while I'm here and thinking about it. Now, so what we want to remember is this is easy as your ABCs. ABCs. Aortic arch. Arch gives rise to brachiocephalic trunk, left common carotid, and left subclavian. So ABCs. A, arch. B, brachiocephalic. C, common carotid. S, subclavian. ABCs. Okay? So the brachiocephalic trunk tells you something about it. Brachio, remember, means arm. Cephalic means head. So this means arm, head, artery. So this artery branches, we sometimes call it the innominate, but it branches into two vessels. One of those vessels it branches into is going to go down through the clavicle to the arm and upper thoracic. So it serves the upper thoracic mostly, but yeah, it goes down to ultimately make your arm arteries. So brachio, that's the subclavian, right subclavian. Right common carotid goes up to serve the head and neck on your right side. So what you have is the common carotid gives rise to internal and external carotid arteries that are going to go up to the brain and face. Now, there is a right subclavian, right common carotid. They come off the brachiocephalic trunk. So the left common carotid on the left side here will come up, and there is a left common carotid artery, and then there is a left subclavian artery. And they do the same thing. They serve the upper thoracic region on the left side. Left common carotid serves the upper head and neck on the left side. Descending aorta does have two divisions, thoracic and abdominal. Thoracic starts at T5 vertebral level and goes down to T12 vertebral level and goes from that range. After you get to the diaphragm and go down, you're going to have the abdominal aorta, which is below diaphragm. So this is all the anatomy we discuss in the heart. Do remind yourself your left ventricle is thicker, more muscular. Though when they both contract, they move equal amounts of blood, the left ventricle produces greater force to move it through the entire body. If it did not move equal amounts of blood, blood would pool. They move equal amounts because blood would accumulate and pool. Now, this can happen when you get ventricular problems where a ventricle becomes hypertrophic. If you get a hypertrophic ventricle and they stop moving blood equally, blood will pool. You will get blood collecting in places, things like that. And that's how blood flows through the heart. And what I'm actually going to do is I'm going to need to stop here because I do have something I need to do immediately after this. So if you can draw this is that blood flow. So I'm going to put this back under here. And I'm going to go through it on this diagram just so you guys are looking at it like this. So if I begin myself at my body systems, if we started at any body system organ, blood would come from the body systems. It would be deoxygenated blood coming into either the superior or inferior vena cava of the heart, towards the heart, to the right atrium. At the right atrium, blood passes through the right atrioventricular valve into right ventricle. From the right ventricle, blood is going to go through the pulmonary semilunar valve to pulmonary trunk, pulmonary arteries, to lungs, where it picks up oxygen, becomes oxygenated blood, coming in the pulmonary veins to the left atrium. And from the left atrium, blood passes through the left atrioventricular valve. As it does, it can then go through the aortic semilunar valve to the aorta, out to all the body systems. And the valves try pulling my aorta. Try pulling my aorta. Okay. So this does conclude my very first lecture on the heart. I do have to stop here because of the time. But anyway, there will be a second lecture, so please be watching out for that. Thank you guys so much for watching. Have a great day.